Today's episode is an interview with Dr. Lauren Castle, a functional medicine pharmacist. She is also a functional medicine advocate, and she educates pharmacists about integrating functional medicine into the profession of pharmacy. Stick with us to the end of the episode. We're also talking about motorcycles today. You're listening to the Pharmacist Voice podcast, a journey-style podcast about my career change from pharmacist to voice actor. I'm your host, Kim Newlove. I alternate solo shows and interview shows. The solo shows are about my career change, and the interview shows feature a variety of people who use their voices to advocate, educate, or entertain. I specialize in medical narration and e-learning. If you have a project in mind, contact me through my website, thepharmacistvoice.com. Thank you for joining me for episode 73. Let me tell you a little more about my guest, then we'll dive right into our interview. Dr. Lauren Castle is the founder of the Functional Medicine Pharmacist Alliance. You can find it at www.fmpha.org. Lauren works as a Market Health and Wellness Director for Walmart in Dayton, Ohio. She earned her Doctor of Pharmacy degree from Ohio Northern University in 2013 and her Master of Science in Human Nutrition and Functional Medicine from University of Western States in 2018. Lauren began her career as a technician for an independent pharmacy in Monroe, Michigan, before moving to Dayton, Ohio, and joining Walmart 9 years ago as an intern. Upon graduating, she spent 3 years as a pharmacy manager in Springfield, Ohio, Livonia, Michigan, and Flint, Michigan, before becoming a pharmacy clinical services manager in the Detroit metro area. In 2017, she returned to Ohio as a Market Health and Wellness Director for 11 Walmart stores. In 2019, she was selected to attend the Walmart shareholders meeting as a social media champion. She has also completed a special project assignment on nutrition initiatives in health and wellness at Walmart's home office in Bentonville, Arkansas. Upon discovering functional medicine in 2015, Lauren began sharing her passion through speaking engagements at the local, state, and national level. Realizing the lack of resources for pharmacists in this emerging field, she founded the Functional Medicine Pharmacist Alliance in 2017. The goal of the Functional Medicine Pharmacist Alliance is to unite pharmacists, practitioners, patients, and organizations in its mission to integrate pharmacists into the practice of functional medicine and functional medicine into the profession of pharmacy. Lauren lives with her husband Seth and their 2 cats, Olive and Pickle. Together, they enjoy attending concerts, traveling, and riding motorcycles. Stay tuned to the end to hear about Lauren's 2017 Harley-Davidson Lowrider S. Without further ado, here's my conversation with Dr. Lauren Castle. Good morning, Lauren. Welcome to the Pharmacist Voice podcast. How are you?
I'm great. Thank you for having me, Kim.
Oh, it's my pleasure. I don't know much about functional medicine pharmacists, and I'm so excited to talk to you. Can you tell me what role you serve now as a functional medicine pharmacist? Are you working directly with patients, or are you more of an advocate for functional medicine pharmacy at this point?
So I think you nailed it with the latter, being an advocate for functional medicine in the pharmacy profession. So I have seen patients in the past, specifically when I was still working in community pharmacy. That's when I first discovered functional medicine and kind of started layering it into my consultations with patients. But from there, I started having a lot of other pharmacists who were asking me questions about functional medicine and how they could also practice this way. So that was what led to creating the Functional Medicine Pharmacists Alliance and my current role as the founder and CEO of that organization.
What problem do functional medicine pharmacists solve for their patients?
So I think that's a great question because it really is the main thing that we do is we actually solve the problems for the patients, those root cause problems that are the reason so many people feel terrible, and yet maybe on their lab work or, based on their diagnosis, everything is fine. So getting to that root cause really does take a unique approach of digging into all of the different experiences that a patient has had, all of the lifestyle factors, and finding out what the problem really is, not just covering it up with medications or anything else that just hides those symptoms instead of treating the actual problem.
It's kind of like a puzzle, isn't it?
It is. And that's actually a terminology that we use in some of the training programs that I've done, is sort of puzzle piecing with your patients to understand that big picture.
Yeah. Do you enjoy that problem solving?
Absolutely. I think that as pharmacists, it's really what we do. We're taught to think critically and to be able to evaluate the situations very objectively, rather than just kind of taking things at face value or, barely scratching the surface. I think inherently we're definitely people who like to get into those details. And so it makes it, really fulfilling to be able to do that for your patients.
Well, I've got to ask you, since you were talking about problem solving, what are two examples of a way you've helped someone or somebody else that you know has helped someone with functional medicine?
Yeah, there's so many pharmacists that are out there, creating their niche in this area. And that's one great way to start, really, is to just pick something you're passionate about within pharmacy and within functional medicine and start integrating that, the next time that you work with a patient. So for me, I really enjoyed working with patients with diabetes. Whenever I was working as a pharmacist on the bench, we started doing point of care testing. So that was something that was big and new and exciting in a way that I could help track outcomes for my patients. So just educating them that, the difference in being at 99 versus 100 on their blood sugar, that wasn't really when the problem started, right? The actual problem started many points before that as their blood sugar was starting to creep up. So just educating people on a more preventative approach and how they could understand food as medicine and not just food as something that we eat that doesn't really matter. That was a very small but easy way to help patients start to reverse their diabetes. I think another example that pharmacists can talk about very simply is patients with thyroid problems. So we know there's a lot of patients who are on Synthroid or levothyroxine, and they may have never been told that there's additional lab work that they could do to see if their type of thyroid problem is something like Hashimoto's, which is an autoimmune condition that can actually be treated in much different ways. But without ever being told that, patients would not know to ask for those types of tests or to even realize that there may be a way to also reverse some of that dysfunction that they're experiencing. So those were just simple conversations that I would have with my patients, and that I think any pharmacist could start with their patients as well.
What's one of the resources functional medicine pharmacists use most often?
There's so many different resources out there. A lot of it comes down to where you kind of do your training. But I think a great place is really just using something like Natural Medicine's database, where they have a drug nutrient interaction checker. So that can be another very easy kind of stepping stone into functional medicine, where you can look at a patient's medication profile and determine if there are nutrients that may be depleted by those medications, thus causing more side effects. So that's probably my most used resource whenever I'm kind of doing a functional medicine MTM session with a patient.
I love resources. They're just thought provoking and helpful, and everybody wins, the patient, the pharmacist, and then you have something you can use to help the next patient. It's great. And now, by mentioning that, maybe there's a pharmacist who's listening who's going to get into that resource and be able to help more people. So, thank you for touching lives just by mentioning a resource. That's great.
Absolutely.
It sounds like what you do, or functional medicine pharmacists do, is optimize patients' medication and supplement regimens with nutrition and fitness and lifestyle choices as an adjunct. Would that be accurate?
That is spot on. So I think the misconception sometimes is that, you have to get everyone off every single medication. That would be more of an alternative kind of model, which In functional medicine, we're using evidence-based medicine. So it doesn't necessarily mean that they can't be on prescription medications and that we have to get them off immediately. As pharmacists, we're medication experts, and our goal is to help make sure that those medications are actually serving their purpose and that they're being used appropriately. So if a patient with diabetes has extremely high blood sugar, we're not going to just stop all of their insulin and stop all of their diabetes drugs. We know that we have to get that diabetes under control and be able to deprescribe in a safe way. So I think that's where pharmacists can play a unique role, especially for patients who maybe have been seeing conventional prescribers, but are also seeing a functional medicine provider. And a pharmacist, just like with any care team, should be part of that picture.
I like how you mentioned the team aspect because really it's not that functional medicine pharmacists are doing their own thing. They're working together with other providers. That leads me into how you founded the Functional Medicine Pharmacist Alliance. Was it so you could work better as teams or alongside other pharmacists to teach them how to do functional medicine pharmacy as a business?
Absolutely. So, founding the Functional Medicine Pharmacist Alliance was something that really just started as a Facebook group after I had given a CE presentation at the Ohio Pharmacists Association. And I had a lot of audience members who came up afterwards and asked where they could learn more and how we could stay in touch and ask more questions. So, it was really just a small Facebook group of about 15 people. But it grew to 1,500 people over 3 years. And so finally this year, we created the membership site so that we could really work more coherently rather than relying on one single platform. So, lots of really great resources are being added every day, from discounts to FXMedCE, which is the functionalmedicinece.com. So, that's another great resource where pharmacists can just get started in learning the basics, to conferences as well. And hopefully, if travel is allowed at some point, we'll be doing some in person retreats as well.
Oh, lots of great opportunities there. Have you had a virtual conference? I have to ask because it's 2020 and we're in the middle of a pandemic.
We did have a virtual meetup. So we were supposed to be meeting in Indianapolis in September of this year. But unfortunately, the live meeting was canceled. And so it was all done virtually. And we had our virtual functional pharmacist meetup at that time.
Do you mind telling me what the attendance was for something like that? Because you have 1,500 members in the group. So I'm just curious how many would go to a virtual conference.
So I think we had about 25 people who joined for this little virtual meetup that we did. The year before, when we had it in person, we actually had a room of about 40 people who came in the night before the conference. And the conference itself, I think, seated around 200 pharmacists. So about a quarter of the attendees came in early just for this meetup that we had, which was pretty exciting.
No, that's great. Anytime you can get like minded people together, good things happen.
Absolutely.
Yes. I understand that you do some guest speaking at conferences and other events outside of functional medicine pharmacy. Can you tell me a little bit about that?
Sure. So, as I mentioned, the Ohio Pharmacists Association was our first opportunity to really start talking about functional medicine to more pharmacists. And they've been so gracious to invite me back every year since then. So, it's been 4 years now of working with them on educating pharmacists on functional medicine. I've also spoken at the Michigan Pharmacists Association conference there. Um, and obviously, online, whenever I get an opportunity to do podcasts, I'm excited to share that message as well.
Yeah, that's great. I actually did a little bit of research in preparation for this interview, and I found that you had done other podcast episodes. And yeah, you're definitely getting the word out about functional medicine pharmacy. Next thing you know, you're going to have your own podcast, Lauren.
That's definitely been on the bucket list to do. So I'm sure I'll get some great tips on how to get started from you.
Yes, we'll have to talk afterwards. I have a friend who is a has a company called Podcast Snap. His name's Mike Lenz. He's actually a pharmacist, voice actor, and podcast host. And he has a company where he helps anybody that needs to start a podcast get started. So there you go. And also, you could talk to my friend Dave Jackson at the School of Podcasting because that's how I got started. He's from
That's
Ohio
awesome.
too.
Oh, nice.
Yeah. So, Lauren, who joins this organization, the Functional Medicine Pharmacists Alliance? Is it just pharmacists or are there other disciplines too?
At this point, I've really narrowed down our target market to be pharmacists. When I first started the alliance, I was intentional in calling it an alliance and not just an association because I wanted to bring together everyone in the medical field as well as patients to understand the role that a pharmacist can play in functional medicine. But I quickly found that marketing was a little confusing for people who visited the website and not really understanding if it was for patients to find a functional medicine pharmacist or physicians to find a functional medicine pharmacist or just for pharmacists to find other pharmacists and actually learn about functional medicine. So right now, the focus is definitely on having pharmacists join as a professional organization to be able to learn more skills, to network with other pharmacists, and to get the help that they need in creating their version of their functional medicine practice.
Great answer. This is good information. You're right about the messaging. When I read an article in Pharmacist magazine, I wasn't sure if it was just for pharmacists or not, but thank you for clearing that up. How do members of the Functional Medicine Pharmacists Alliance feel after they join your group?
So I think for most people, whenever they're kind of just searching online and they know just a little bit about functional medicine, their first natural question is, well, how do I do this as a pharmacist? So if you Google functional medicine pharmacist, you'll find fmpha.org. And for most people, there's this sense of, wow, I found my tribe. There are other pharmacists that are doing this. I'm not alone on this island. And now I actually know where I can connect with people and talk about this and get excited about what we can all do together. And I think the togetherness is something I really emphasize as well, because in order for us to really bring this type of change to the pharmacy profession, it's going to take all of us working together. It's not going to be just one person or one pharmacy that is able to change the whole profession of pharmacy and how we practice. So the more, the merrier.
I like how inclusive you make it sound because anybody that's trying something new needs education and to learn the best practices. And for you to share that with them is important. I like the CE opportunities. The networking is so important. Business training, events, and advocacy. I mean, it all sounds like the place to go. Congratulations on
Absolutely.
founding a great association.
Thank you.
You're welcome. Before we change topics, is there anything else you want to talk about when it comes to functional medicine pharmacy?
I feel like we kind of covered a lot. So I don't think there's anything that we really missed.
Awesome. Well, now we're going to talk about something that nobody expected us to talk about: motorcycles.
Yes,
All right. Lauren, do you ride motorcycles?
I do. I've been riding for about 5 years now, and my current motorcycle is a 2017 Harley Davidson Lowrider S.
Awesome. Now, that's not your first bike, though, right? What was your first bike?
My first bike my husband bought for me was a 1974 KZ 400. So it was a little green kind of cafe racer style bike.
How do you like the hand position on those?
So I definitely like a more aggressive stance for my motorcycle. So you're definitely kind of more on top of the bike, and forward leaning and kind of have your knees tucked in a little bit. So for me, I enjoy that. The bike that I had in between these two was a 2015 Sportster. So with that bike, it was also a more aggressive stance as well. So I like going fast.
All right. Well, that's awesome. The reason I bring this up is I ride too, and I so very rarely get to talk to another pharmacist who is a motorcycle rider. So, thank you for talking to me about this. And I just wanted to ask, how important is it for pharmacists to have hobbies?
Oh, it's critical. I think, as much as I am obsessed with functional medicine pharmacy and could do it in my sleep at the same time, it's still a business and you still have to have those outlets to be able to go and, just do something different so that you don't experience burnout even from the things that you love. So for me, that's motorcycling, and you get outside and just kind of clear your mind. And, I think it's a great activity I get to do with my husband too.
Yes, that's awesome. And what does he ride?
Well, we have about 5 motorcycles that he has in our garage right now. But the one he rides most often is his Springer Softail.
I know bikes, but I actually don't know what that is. Is that also a Harley?
It is.
Awesome. I'll have to look
So,
that up. Very good. Now, those are big engine bikes that you and he have, right? I mean, like 1100 and up. What do you guys have?
yeah. So for mine, it's 110 CI, so cubic inches. So it's basically like a car.
But it takes off fast.
Oh, yes. Yes. Very fast.
Let's talk about geography just briefly. I'm in the Toledo, Ohio area, and you are in what part of Ohio?
I'm in Dayton, Ohio.
All right, we're about 2 hours away from each other, right?
Yeah,
One of these times, we're going to have to get together and ride
definitely.
just for the heck of it, and definitely get a picture and put it on Instagram because that's just fun. Um,
Yes, I agree.
I have bikes that are much smaller than yours and your husband's. I'm on my fifth bike. I think you're on your third. And we talked about having hobbies, and you have to have something that brings you joy. What I like is that both of my hands and both of my feet are busy, and it allows my mind to think and wander and process things. What is it about writing that you like?
I agree. It's definitely just, you know, so freeing to get out there. For me, it was a little scary to get my motorcycle endorsement actually, because I grew up on the back of my dad's motorcycle or my grandpa's motorcycle or my husband's motorcycle, but I had never taken the step to actually learn how to ride. Some kids grow up riding dirt bikes and things like that, but I didn't have that experience. So when I finally signed up for my motorcycle safety course, I was the only person in the group that had zero experience. And the great thing about it is that they teach you the right way to ride from day one. So I didn't have any bad habits that I needed to break or things that I did that were unsafe. I truly learned how to ride the right way. And it was just such a confidence builder to get out there and do something that not a lot of people actually know how to do. And, you know, it was exhilarating. It's just something that is an adrenaline rush. And so when you're on a motorcycle, there's really no way to have your mind wandering off to all these other things. You're in that moment. You can't be in the future or in the past. You're just truly present. So that's what I love about it.
Yeah, you have to think about surviving, really, because when there's a semi with a 53-foot trailer passing you and you're going 70 miles per hour, you got one thing to worry about:
Yeah,
surviving.
exactly.
Yes, absolutely. But it's fun. Like you said, it's exhilarating for sure. Now, I've got to ask, how did you learn how to ride? You said there was a structured program. I think I know what you're going to say, but I want you to say it.
Yeah, the Motorcycle Safety Foundation. So they have classes all throughout Ohio, and I'm sure they're kind of nationwide too. But it basically is just a 2-day class that you go to and you learn kind of all the rules of the road in a classroom setting. And then you get out there and they teach you the basics of, I mean, literally just step one is turn the motorcycle on and walk it across the parking lot. Like you don't even stand on it or ride. It's just getting comfortable with the bike for a lot of people. That is that first step to not feeling as intimidated by it. And then step two, which for me was where I always seemed to have trouble when I tried to learn from other people, was understanding the friction point on the bike. And that is the key. Once you understand that, the rest of it I feel like was so easy. But it just is a great way to learn whenever they teach it in such a simple, understanding way.
Right on. Yes. I learned from, we used to call it the Motorcycle Ohio program, but it's probably the same thing. You buy a helmet, they provide the bike. And is that the program that you went through?
Yes, I think that is the same one.
Yeah, that was great because then you don't have to buy a dinky little small engine bike to get yourself started. They provide it. It was nice. Yeah, much respect to you for being a safe rider. And I just recognize this parallel between functional medicine pharmacy and the motorcycle Ohio program and learning how to do things the right way. I feel like you do things the right way and you find things that you love and you go for it. And I just recognize that. And so I just wanted to give you some credit for carving your own path, doing your own thing, and loving all of it. That's awesome.
Absolutely. That's really sweet. Thank you.
Oh, you're welcome. And it's nice to talk about bikes with somebody else. It's just fun.
Agreed.
Prior to this interview, we talked more about motorcycles than we had talked about functional medicine pharmacy or pharmacy in general. And I'm laughing because it's just fun to find another pharmacist writer and just talk about something other than pharmacy.
It absolutely is.
Yep. I was even asking you for helmet advice. So thanks again for those tips.
Of course. Built Well is my favorite company.
Now, have you ever gone to any of those international motorcycle shows like Cleveland?
I have not been to the one in Cleveland. We have one down in Cincinnati that is at Rheingeist Brewing Company. So that one is called Garage Brewed, and it's a moto show. So I've been to that one a couple times, and it's always amazing. So I ride with other women. We're in a group called the Litas. So we all go to that event when we can.
Oh, that sounds like fun. See, we had talked about conferences and how you are a speaker at conferences and online conference too. I consider these motorcycle shows kind of like conferences for motorcycle riders. And it's kind of refreshing to get out there and just see what people are selling, what bikes are out, what are people wearing.
Mm-hmm.
It's just kind of fun.
It is.
Well, let's wrap this up. Is there anything else you'd like to share about functional medicine pharmacy or motorcycles before we end our interview?
I would just say that if you are interested in finding a way to truly help your patients get better, that functional medicine is probably the answer you're looking for. And I would invite you to come and check us out at fmpha.org. You can also find us on Facebook, Instagram, and LinkedIn.
Very good. And I'll have all of Lauren's social media links and websites in the show notes, so check those out. Thank you very much, Lauren, for being on the Pharmacist Voice podcast. Have a great weekend.
Thanks, Kim. We'll talk soon.
Thank you for joining me for episode 73 of the Pharmacist Voice podcast. Visit thepharmacistvoice.com to subscribe and read the show notes.